I think I'm at a point in my career where I just look for tools that can help. And I think some of the stuff I learned here are definitely going to be things that I can reach into and see if they'll apply to people that I'm working with.
It's been something I've wanted to do for a long time because I felt that NLP was an important tool that I could use, and it was a missing tool in my case. And of course I've read about it and I've listened to audiobooks and all those kinds of good things. But to actually be in the class and to be listening and being actively involved, that's the big difference. NLP teaches that your body is really important as well as your mind. So that mind-body connection, it comes across in class so much stronger than I actually expected.
It's amazing really how simplistic some of the tools really are, but how grand and enormous some of the shifts are that are created in people. It's amazing to see the shifts that happen with all my classmates. It's just awesome.
Tools that I can use in my everyday life and tools that I can use with my clients.
Probably the most useful thing I learned, and you use it in all these, is learning resources. And that's a new word that I just never thought of. Like when you first described it, I thought, what the heck, why is that called a resource? But it's brilliant. It's brilliant to call something that you've felt and you really know well a resource, because you can get back to that place and use it as an anchor for other situations that you're in. So learning to do that, I think, was probably the most useful thing, and I'm sure I'm going to be using that on people totally, suspectingly and unsuspectingly as well.
The class was phenomenal. It was very interactive, very dense with information, and it's just a great time. I definitely do it again.
The person who is the therapist, the practitioner, the physician, whatever, is not the one doing the work. This is really about people's self-discovery, and it's guided self-discovery, which I have never learned. I mean, that's not something I learned about in medical school, right? And that's not something that I really practice, because I find that people come to me asking for help. So they come to see me and say, I'm going through this. What can you do for me? Are there resources for me? And by resources, I mean they want to be referred somewhere, or they want like a program or something. But what I think is really kind of brilliant about this is that it teaches people that they're their biggest resource. And if you really dig deep, that you will discover a lot about yourself that's going to help you.
Honestly, I was completely taken aback at this entire experience was really new to me, the NLP experience. So I learned a lot. It's super high quality, well organized, and run very professionally. So I really appreciated that.
There was a lot of benefit, both in terms of me learning and also in the experience. One of the nice things about the course was that we really get to practice the techniques as we learn them. So we break up into little groups and practice on each other, and so that allows me to practice being the therapist, but also a chance to actually work on some things and experience what it's like when someone does NLP to me. And I found some amazing changes that surprised me. So
I would recommend this course to any person out there who wants to help anybody, whether it is somebody who is actually doing change work now or somebody who is interested in it for their own personal life and family. It's very user-friendly tools, and anybody can do this stuff.
In fact, I was so ready for this class. I don't think anyone was more ready and excited about this class than I was. I'm ready to just explode, and I knew that this class would provide me with the knowledge, the practice, the tools that I've been yearning for to just bring to my own life and to the people in my life, in my practice, in my world. So
I also got to experience having this 6-step reframe done on me, which was kind of fascinating. Everybody has their own unique experience when it happens, but you end up selecting new behaviors to replace a behavior that you want to change, and it's happening at an unconscious level, so you're not really aware of exactly what's happening, but something's happening in your mind and people experience it differently. And for me, it was kind of fascinating. There were like, it was like snow coming out of a snowmaker on the mountain and blowing at me, and there were options coming out, and I was sort of filtering them out and grabbing them, and it was almost like a dream happening in real time. So it's a fascinating experience, and so that's just one of several core techniques we've learned here.
I had a Zoom call, a video call with her a couple of days after the first weekend part of the training, and she, even though I'd only run through the process once in class, it was extremely powerful for her when we did it, over video, and she experienced enormous shifts. She reported to me 2 days later that she felt a big shift in herself. So
I find not everybody appreciates the talents of a hypnotist. Some people are scared of hypnotism because they don't understand it. And the medical profession in particular does their client base, the patients, a disservice by not knowing how effective it really is and when they should be using it, because there are many times when that would be the best approach for a patient. And I think NLP is a good compromise in the sense that it doesn't have the stigma associated that hypnosis does, but can accomplish a lot of the same goals. And it's relatively quick in a lot of cases, and doctors are always busy. So I think doctors in general should learn this sort of technique, these sort of techniques, in order to be able to really help their patients when the particular problem calls for this, because there really are situations where that's the best approach. A lot of times doctors are only trained to prescribe medicine for something like, say, a panic attack, when there's a much better way to do it with NLP or hypnosis. And so taking a course like this would give them that awareness and the talent to actually do it.
Because I realize that with NLP, you really don't need to know why, right? And people don't really need to share more than they're willing to share, which is what's really amazing about this, because there are so many people who could benefit from some kind of a better understanding of themselves, but don't want to talk about it because it's painful to talk about it, or they feel judged. And this process really allows them to get the help they need to move forward without feeling judgment, which I think is really very unique. That's the part I really, really like. There are some situations I think people would never get help. So this is an option for people who are looking for that.
And I feel like this is a tool that I could easily transfer to my clinical practice and teach patients to do the same.
This training was pretty comprehensive. I feel like I can leave here with some solid tools and strategies. I'm not going to be the best at it, but I think, you know what, that's where practice comes in. I need to go start playing around with some of this stuff, seeing where it fits into what I do. But the training was comprehensive enough that I feel like I'm leaving here with some really great skills and tools.
It takes your conscious mind out of the game a little bit. When you're moving your body around, all of a sudden you have to go inside to figure things out, and that might be easier for some people than just sitting in a chair talking or having somebody, do something from a chair. I think it's that mind-body movement thing is a whole other way of looking at things.
Absolutely. I think it's an incredible experience. I think the tools are on point. I think anyone working with others in a coaching capacity, in a therapeutic capacity, I think these tools can be applied in many different modalities across the board, in any profession where you're working with people to help them change things they want to change, whether it be remedial change or generative change. So I think this course was incredible, and I would encourage anyone to take it.
So I would recommend this course and learning more about NLP in general to anybody who works with anybody who's trying to improve their lives, or anyone who does any kind of change work. And I feel like as a family doctor, that's a ton of what I do. So I make recommendations all the time. A lot of people think that people come in to see family doctors and we send them off with prescriptions, but more and more we're realizing that it's not the prescriptions that there's tremendous evidence for some really basic things. It's some of those lifestyle modifications that we need to get people to adopt, and they're hard to do. So learning strategies to help people make the changes we know are good for their health is so important. So I think anybody who does any work in any area that requires working with people to make any kind of change, this should be something that they learn about in whatever way they can.
I recommend this definitely to change workers, but I also recommend this to people who are on a personal journey that want the change and need the change, because before you can help anybody else, you need to help yourself first. And I think tools that we learn in courses like Mohammed's NLP course are ways that we can make that personal change and then take that personal change out to other people. And I can see even using this with my kids as a mom and using these techniques to help them, because it's universal. Everybody needs some help somewhere in their life.